Hi, Gus. Nice to have you back on the podcast. It's been about a year since we did a couple of podcasts together. What's been going on in your life for the last slow year with no cruise ships to go visit and things like that?
Well, good morning, John. It's great to see you again. Yes, it has been a while, about 14 months plus, maybe a little bit longer, since COVID has hit the pandemic has hit us. Um, I've been busy. I'll be honest with you. I've been busy. Even though I retired in 1999 from Public Health Agency, uh, again on the cruise ships for a while. Then, of course, then the pandemic. Uh, I'm involved. I'm casual work right now for the province of New Brunswick, which is
Hmm.
involving the mandatory order, chief medical health officer's order, mostly education, compliance, and working with the health protection team. And then, of course, I do some casual work with the public health agency still, and set up the swab testing site in St. Stephen border crossing near Kellis, Maine. And I'll be back down there again next month for a week. And I had three ferry companies, domestic ferry companies
Hmm.
I provide public health consultation to. One company is now moved on, but I still have two other companies. So it keeps me busy. And on top of that, I still write the leadership e-newsletter or electronic newsletter for
Hmm.
Global Public Health Services. And that keeps me busy. And on top of that, yeah, go to the RV when I get a chance.
That's good. Yeah, with the let's talk about the newsletter first. I mean, you started that a while ago. What's the number of newsletters you've put out so far?
Okay. I'll give a little background
Sure,
first before I answer the
sure.
question. Started the newsletter back in January, the end of January 2020, as the pandemic was hitting around the world and uh, on the cruise industry itself, the global cruise industry. The intent at the start was just to keep track of what was going on. Nobody really knew anything about the pandemic at the time, how long it was going to last.
Hmm.
But one thing, I mean, cruise lines were shutting down left, right, and center. And it was very devastating to the cruise industry. So my intent was to keep global public health colleagues informed on what was going on. And at the start, that was great. And then talking with Catherine, we saw the value of this newsletter and shifting from the format that we were doing before, which is just a
Hmm.
PDF, write to you every day or so forth, to a more electronic newsletter. That newsletter is now expanded to 280 issues.
Hmm.
Today is the 280th. Is 4,100 and some odd articles. So it's just republishing articles around the world about the
Hmm.
cruise industry and the impact of COVID-19's had on the industry, and now the slow but steady recovery and restart of the cruise industry worldwide. So it's we've got many subscribers.
Hmm.
I would always like to see more, but not everybody likes to give their email address out, but they don't
Right.
need to give their email address out. They can go to the Global Public Health Services website. That's gphsconsulting.com. And there's a link on the
Hmm.
website. And then from that there, they can click on the link and it'll take them, they can read the last 100 issues
Hmm.
that are posted on there now. So it's been very exciting writing it. And I'll be honest with you, it takes up a lot of time.
Yeah. Well, and again, you've for at least most of us at GPHS, you've been kind of the authority of trying to track down all this stuff. It takes a lot of time researching and all those things. And it's interesting, when you started, you know, we were looking at numbers, like you said, and that
Right.
that was those were the scary numbers when we didn't really we all we could do was count. Um, Now the nice thing, instead of counting cases and deaths and things like that, we're able to look a little bit more at vaccinations and who's the numbers getting vaccinated and things like that. And that's really helpful as well, because that gives us an idea. And the cruise industry, if they're looking at it, I mean, they're getting probably even more up to date information that we get and that you get. And you brought up a point. You and I talked just the other day, and you were saying that some of the challenges that you're having in Canada, but not only Canada, everywhere, is those numbers are constantly changing. It's a little bit like looking at the stock market. I mean,
Yeah.
from minute to minute, we're getting additional information as quarantining, as far as travel, all of these different things. And so you've been really able to help keep us up to date on sort of what's going on, at least as best as we can, looking at the media and what they're publishing. So yeah, it's been very helpful.
The one thing with the global cruise industry right now, the one thing that is constant is the change itself. If I tell you something now about what's happening this morning, Carnival released information on their vaccines and masking, but vaccines in particular.
Mm-hmm,
Um, the challenges that are in the states, especially in Florida and Texas, with your governors and the laws in those two
mm-hmm,
those two states. Um, but tomorrow that could change.
right.
And that's the biggest thing, and that's what's going on. Florida right now with the governor's mandate, his bill, stating that you cannot ask a traveler their vaccine state, is challenging because the cruise lines, for them getting up and operating, they really have two options: 95% passenger and crew vaccinated, and then the restrictions can be loosened. Or if they don't have 95% passenger and crew, but mainly passenger,
Mm-hmm,
95% crew, I'm confident they'll get 95%. Passengers, not so confident. Then there's all these restrictions are still in place.
right.
And
The test cruises and
yes,
all of these other things that are associated with it. Yeah.
so right now there's about a dozen ships, cruise ships in Florida and so forth that are going through testing
Mm-hmm,
process right now. Some have started, some are getting lined up to get started. Now, this challenge of the vaccines is also just signed in a bill in Texas, brought in a bill. Governor Austin brought in the same one that's in Florida, where you cannot
mm-hmm,
ask
right.
passengers or anybody if the vaccine state. So it's going to put the cruise industry in Florida and the cruise industry in Texas in a little bit of a dilemma. I think they can manage it,
Mm-hmm.
and you're going to see on cruises basically those. I don't know how they're going to identify them. That's maybe a
I
mark on your forehead or something, but those that are fully vaccinated
right.
and those that are not. Those that are fully vaccinated will have a lot of the restrictions lifted. They may not
Right.
have to wear a mask in a certain area
Mm-hmm,
outside the public. Or maybe they'll be able to go to buffet style dining
right.
where they can serve themselves. Again, everybody in there is vaccinated, fully vaccinated, and those that are not vaccinated or fully or partial or don't have any vaccines
Mm-hmm.
at all, they're going to have a lot of restrictions. Yeah.
Yeah, and I made a comment on one of the posts. I think it was on in LinkedIn. I think it was concerning celebrity, because celebrity was, they were looking at going out of Port Everglades or Miami, and they were challenging the governor's thing, and I my comment was, well, okay, so the governor says you're going to get fined what, $5,000 for every time you ask somebody their vaccination status. I
Correct.
said, well, I see it very easily. Don't ask them. Just tell them on the letter when they come that, oh, by the way, if you don't show us that you're vaccinated, then you're not going to be allowed to join the ship. So don't ask them. Just say, you need to volunteer it, and if you don't volunteer it, you're not sailing. Seems pretty easy to me, but I'm just a simple public health guy, not a lawyer. So,
Yeah.
but yeah,
It-
but it's going to be a challenge. And we talk most of the time when you talk to any of the public health guys or people, and it's like, listen, people, I mean, vaccination is the way to go to get this herd immunity.
yeah.
We have people that have been sick. Yes, that helps. But, you know, if you want to be open and able to do all the things you want to do, just get vaccinated and move on with our lives. So, yeah.
I think the cruise lines is going to have to be much more forthcoming on communicating with the future passengers out front.
Yep.
before they come anywhere near the vessel, the terminal and so forth, that this is the expectations, or else you thank you for your money, the credit, and then,
Yeah.
whenever you're ready. Uh, that part, I mean, just wearing masks going into a terminal, that has not changed in the US or even in Canada here.
Hmm.
That inside a building, like a federally controlled building in the States, you must still wear a mask. Go to that terminal,
Hmm.
wear a mask until you get on the vessel. Again, there's the two cruises. There's the cruise with the 95% fully
Yep.
vaccinated passengers,
Yep.
and then there's the cruise with the not vaccinated or some vaccinated or partially vaccinated passengers. Two
Right.
two different
Right.
cruises.
Yep. And Dave and I talked about it on the first one
Yeah.
the first podcast we had as well. And we said, because there at the moment, there are companies, cruise line companies, that just cannot vaccinate 95%. The best example of that is Disney, right? Disney's predominantly
Children.
kids, and we're down to now, I guess it's in the US anyway, 12-year-old and above. You can are approved for vaccination, but below that, there's the vaccines have not been properly tested and vetted to make sure that they're safe for them. So for some of them, yeah, the test cruise is going to be something that they have to do. Others, though, there's no reason, when we're talking about the cruise lines that market primarily to people 60 and older, yeah, there's really no reason why they shouldn't be able to move forward with that, except for people's reluctance to get
Yeah.
vaccinated.
But even gets more complicated across the US right now. And of course, in Canada, there is no cruising
Yeah.
right now until February the 28th next year at the earliest. I'll comment on that in a few minutes.
Hmm.
Thoughts on that.
Hmm.
But moving ahead, if you're taking a cruise out of Seattle to Alaska, you're going to have to be vaccinated, because that both the state of Alaska and Washington, you're going to be vaccinated before you
Right.
get on the vessel. It's not doesn't fall under the bill of
Correct.
Florida and Texas.
Right. Yeah.
Um, if you're on a vessel out of Singapore, the Quantum of the Seas, again, that's complying with Singapore public health rules
Exactly.
and so forth. So
Exactly.
totally different. You look at UK opened up last month in May, cruising, so things are going well there so far.
Hmm.
Everybody's vaccinated or has to be vaccinated to get on those cruises. I see Spain is opening up to cruising and so forth. So the world is opening up.
Hmm.
The exceptions to that is Australia has put everything on hold until the 17th of September. Keeping in mind, in Australia, it's their fall right now.
That's right. That's right.
And then there's Canada that's decreed that there'll be no cruising here till at least February the 28th, 2022. We never had any cruises here in February, as far as I know.
Right. Now, is there, you don't see that potentially being reconsidered, as because you were with vaccinations, Canada was running a little bit behind the US with the vaccination and things like that, at least in a lot of areas. Do you think that may change as more Canadians get vaccinated or not?
Right now in Canada, there's a big push to get first-time vaccinations out there. We're doing exceptionally
Hmm.
well. Today, in the province of New Brunswick, where I live, yesterday we finished at 74.6%,
Wow.
and at 75%, which we expect to reach today, of the
Hmm.
first-time vaccinations.
Right.
We can go to our next phase, which will be the step towards green. Okay, the
Oh,
pathway to
excellent. Yeah.
green, which is
Yeah.
opening up more, but it'll be going in phases. Now,
Hmm.
Canada in itself, I think, is around 64 or so percent. Is uh, when you look across the country, I could be a little wrong on that, but I thought it
Hmm.
was close on that when I read. Um, the problem is, I don't think Canada is ready for cruise ships this year, because it
Okay.
takes quite a while to get
For
to the
them to
point
ramp
of
up and get ready
ramp
to
up
go.
and get.
Sure.
Here we are in June. Around the corner is July, which is our two busiest cruise seasons, July and
Right.
August. And then we're into the fall colors come the
Yeah.
fall here in the
Yeah.
East Coast. I don't see that will happen. I think Canada did itself a little bit of a disservice by being so staunch in their thoughts that inflexibility when the the Passenger Vessel
Mm-hmm.
Service Act, they
Mm-hmm.
were asked to allow for technical calls
Right.
of vessels into
Mm-hmm.
Vancouver and Victoria. And that technical call could be for resupply, could be for
Sure.
either reason. Passengers didn't have to get off on the technical call, and that
Mm-hmm.
would have allowed the vessel to
Right.
meet the intent of your act, which is
Sure.
the
Yep.
Passenger Vessel Services Act.
Mm-hmm.
By being so inflexible, President Biden's now approved the Alaska Tourism
Mm-hmm.
Restoration Act, which it only is to the 28th of February next year, right now,
Mm-hmm.
that act. But now cruise ships can now go to Alaska, bypassing any stops in Canada as
Right.
what was required under your Passenger Vessel
Right.
Services Act.
Yeah,
But
and it's
sorry, John.
go no, go ahead. Go ahead.
But what is caused now is this senator out of Utah
Yeah.
is now calling for the repeal of this 135-year-old act.
Yeah.
Um, when they wrote that 135 years ago, it was the intent was to protect business and so forth in the U.S. And I totally understand that.
Mm-hmm.
So maybe it does need to be modernized. Um, and I see that this senator there, Lee is his name, Senator
Mm-hmm.
Lee, has proposed 3 new acts that'll address the concerns there.
Yeah.
The concerns on the West Coast in particular, quite different here on the East Coast. The West Coast, the vessels leave out of Seattle or so forth and head on the inside passage all the way up to Alaska.
Mm-hmm.
And I saw today that in the news there in Skagway, they've had their first vessel. The American Constellation came in last Friday. So things are slow, but they're picking up. But if this act, I'm talking this new proposed
Mm-hmm.
repeal of the act, that could have detrimental impact for cruising on the west coast of Canada.
Oh, absolutely. And for our listeners that may not be as familiar as you and I are with it, yeah, the law basically said that foreign flagged ship, which most cruise ships are, except for the smaller ones, cannot load cargo. And sorry, people, but
Yeah,
you are cargo when you're on the cruise ship, cannot load cargo in a U.S. port and sail to another U.S. port or discharge that cargo in another U.S. port without having an international port call. So, yeah, that's why most of the ones going to Alaska, the big ones, like you said, if they originate in Seattle, they may sail and bypass Canada on the way up, but on the way back, usually they're stopping in
yeah,
Victoria or something like that. But also why those that are originating in Vancouver, so you have your international port call. So then you can go to Alaska and go to multiple ports in Alaska and come back. I always seem to get caught in it on the other coast, on the East Coast with Canada, because I would join a ship in Montreal and then have about 4 or 5 days worth of work and then want to get off in Halifax or St. John's, and the Canadians say, well, as long as the cruise line is ready to pay the $10,000 fine for you to get off, and they never are. So then
I
I'm
never.
either in Bar Harbor or Boston or someplace like that.
Yeah.
Yeah. So.
So, anyways, I'll sum up my opinion on this. Is I
Mm-hmm.
think by Canada being so inflexible to these technical calls that were originally proposed, they've
Right.
set themselves up here that it could be, it's a 135-year-old act.
Right.
It's just this is going forward. It's just a catalyst to open it up,
Mm-hmm.
maybe repeal that act. I still believe in the end that cruising. I'll still visit the west coast of like Victoria and Vancouver, come
Sure.
out of Seattle. I mean, the passengers are going to demand that.
Exactly.
But maybe it needs to be cleaned up. I just think that by that inflexibility, they by default they've wakened a sleeping giant.
Yeah.
Now,
And another thing, and one of the other things you've been busy with, and you mentioned it with provincial and some of the federal things with, I forget the term you use for it, but it had to deal with border crossings and things like that, and
yeah,
the quarantining. Uh, and I saw in one of the newsletters that you can go out of Canada, and if you can prove that you're fully vaccinated, then you don't have to quarantine when you come back. Is that correct?
Okay, as the rules stand today, only essential travel
Okay.
outside of Canada right now. What the federal government is proposing in early July, no fixed date yet,
Mm-hmm.
is that if you're a fully vaccinated Canadian, then you can, for non-essential travel back to Canada. Normally what happened today, you would have to go to a quarantine hotel or an isolation hotel for 3 days.
Mm-hmm.
And there's a hefty price tag to that you
Sure.
have to pay. You would have to have a PCR test prior,
Mm-hmm.
which will be negative before getting on the flight. You will get a second test at the airport on arrival in one of the 4 airports, point of entries: Vancouver, Calgary, Montreal, or Toronto.
Mm-hmm.
These are for air travel. Then you will be sent to an isolation hotel for 3 days.
Mm-hmm.
Wait for that second test to be come back negative. If it comes back positive, then you're going to be quarantined or isolated
Mm-hmm.
for up to 14 days. If it's negative, then you can carry on to your destination and complete your quarantine time at your
At home.
destination.
Yeah. Okay.
Okay, at home.
Yeah.
In early July, the federal government is loosening up the restrictions to say if you're a fully vaccinated Canadian,
Mm-hmm.
you can do for non-essential travel now. You can come back. I'm thinking of the snowbirds, for example,
Right.
for that
Sure.
term.
Sure. Mm-hmm.
Can come back to Canada, land in Toronto, prove that they're being fully vaccinated, prove that they had a negative PCR test
Mm-hmm.
before getting on the airline, still get tested in Toronto, using as an example. They can now go home to their destination, still quarantine themselves at home for the 3 days until they get their results.
Mm-hmm.
And if they are negative, then they can carry on as if they didn't go anywhere.
Right. Yeah. No. And speaking from someone who has made a couple of trips to Norway, yeah, quarantining is in Norway. I had to quarantine for 10 days on arrival in Norway, and that is the longest 10 days
Yeah.
that you can ever imagine. But that brings me to another thing that I wanted to talk about as well, because I've had to explain these terms to people a lot. There's quarantine,
Yeah.
so we quarantine people and we isolate people. So
Okay.
that definition, I think we have a tendency to kind of lump everything together, but it's not. So with quarantine, so you having worked at some of these quarantine hotels and things like that, helping
Yeah.
set them up. So you want to give your take on those two different things. So
Yeah.
let's
Uh,
start with quarantine.
First of all, you're right. Everybody mixes them up.
Yeah.
Quarantine is a person, for example, has traveled from an affected area or meets the definition under the Quarantine Act coming into
Mm-hmm.
Canada, but uh, has no symptoms, asymptomatic, feels um, no symptoms whatsoever.
Mm-hmm.
So now, but because of their travel itinerary and so forth, they must go into a quarantine state
Mm-hmm.
until for a period of time. So normally they're separated from else. They can do it at home or wherever. That depends
Right.
on the jurisdiction,
Mm-hmm.
but they would do their 14 days, maybe with their family and so
Right.
forth. Right.
Mm-hmm.
An isolation is a person that's now being exposed or may have been exposed, and the
Mm-hmm.
information's there, and now they're going to be in isolation, and their movements are now restricted
Mm-hmm.
for those 14 days.
Right. And
So
so they are either symptomatic or they've tested positive on a PCR or another quick test. And
for
then,
yeah,
yeah,
for isolation. Yeah,
right.
yeah,
And the thing is usually the people that are isolated get pardoned sooner than the quarantine, because once you get, at least in the US, it was as long as you were afebrile, no temperature after
yeah,
for 2 days, then you're released from isolation. Whereas the people that came close to you, they're still sitting and they can't leave their home or the hotel for another 3 or 4 days because they're just waiting to get symptomatic or
Yeah.
test positive to it. So it's an important differentiation. And I think it's good that they understand kind of the difference between, that isolation and quarantine and things like that.
Again,
So,
we're still in Canada. We still work on the 14-day rule. So it's
right.
14 days.
Oh, okay. No matter what.
Yeah.
Okay.
In the States, I believe you're 7 days now or 10.
Something like that. Yeah.
Yeah. Depends
Yeah.
on the state and so on and
Right.
so forth. So we're
Yeah.
14 days.
Yeah.
Um, so with this potential of the border loosening, the rules loosening coming in July, that quarantine period will go from 14 days down to approximately 3 days or sooner if you can get a PCR test, can be results come back negative sooner for that non-essential, fully vaccinated Canadian coming home.
Sure.
Yeah,
Sure.
so
Yeah, so it's interesting times.
yeah,
I'm looking forward to the U.S. Canadian bordering open up because, we can share a beer through the computer, but it's just not the same as
it's not the
sitting
same.
next to you, telling stories and
Yeah,
drinking a beer.
yeah.
So yeah, I'm looking forward to that sort of
I
opening up. So that's
yeah.
good.
Before we sum up here, John,
Sure.
I really encourage everybody to uh, either subscribe to the leadership newsletter itself. You get it three
Absolutely.
days,
Yeah.
3 days a week. Is Monday, Wednesdays, and Fridays. It comes out nice and early in the morning, electronically to your mailbox. Or if you don't want to subscribe, you can still go to GPS consulting.com and you can read the last 100 issues. And you still go to that same website too if you want to subscribe.
Hmm.
There's a lot of great information in there. Um, it's constantly changing. I stress to people when I talk to them, get your information from reputable sources, either from the
Hmm.
government on COVID and so forth, and on the cruise lines, go to their applicable cruise line website, read the latest information, and I strongly urge you to go back and visit it multiple times because it's changing that fast.
Yeah, and just one. So another thing, and we always want to talk about too, because we do have people from the cruise lines that are following us, and some crew members and things like that too. One of the other big things that, as we get started now again, with crew coming back, and you had posted something I think too, and we've talked about it numerous times that it's not a faucet that we can turn on and all of a sudden crew come pouring in. Having to find that crew again, making sure they're vaccinated, tested, get them on airplanes where there's starting to come back more and more flights to get people, but to get them back to the ship and get them ready to start accepting guests and cruising again. There's a lot of training that needs to be done as part of that. And Dave and I talked about it. You and I have talked about it. We'll continue to mention it as well for the crew and the cruise lines is all this emphasis on COVID, which has been very important and it still is very important. Are not concerned, but we want to guard against the fact that that's all they worry about on the ship. But that's not what we go back to sort of the basis of what the Canadian program and the VSP, the US program is. And the requirements of those inspection programs are to prevent primarily gastrointestinal illness. And so we need to make sure that all the food handling practices, potable water tanks and distribution systems are completely disinfected because they haven't been in full use. There's so many other things that have to go on as they get ready to start accepting passengers and cruising and things like that. And the two programs, the Canadian program and the U.S. program, and also in Europe, the ShipSAN program and things like that, have a lot of valuable information, but they provide a valuable service too. The cruise lines and the crew, uh, they cringe when any of us come on board to do an inspection, but I think in the back of their minds, they realize that the environment they work in is safer because of these different programs that are out there. So
I agree with you, John. As one thing as the cruise lines start ramping up to get back into service, I've seen numbers around it takes 90 days, or even greater to get the the vessel ready, all that training that you were speaking about, finding competent, trained individuals is a huge challenge.
Mm-hmm.
I was listening to a webinar the other day from DNV that
Mm-hmm.
they were talking about the challenge of getting medical personnel to get
Sure.
onto the vessel and so forth. And then I was reading an article that Royal Caribbean has got 400 Indians that are
Mm-hmm.
they're in isolation right now, and they're going to be flying directly by a charter flight from Royal
Right.
Caribbean to Florida and getting on the vessels. So there's a huge challenge. You've got to remember that most of these crew members that were furloughed or let go, wherever the case, the language you use,
Mm-hmm.
has probably found other jobs out there.
Sure. Absolutely.
Um, they're land-based, they're probably closer to home, and so on and so forth. And are they jumping at the bit to go back onto the cruise ships? I don't know. But it's a challenge that's out there
It's a
right
good
now.
point. I mean, I don't think, if they could earn a good living at home,
Yeah,
most of them wouldn't choose to spend 8 to 12 months away from their family to go to work and take care of us on board the cruise ships. And, again, we always stress too that uh, we encourage people to take cruises. It's a good way to holiday. It's a good way to see things and relax and things like that. And so, yeah, we're anxious. We're anxious to get back to it. We're anxious for them to get back to it as well. So,
I saw an article the other day saying there's 17 cruise ships right now we operate in U.S. waters, are the U.S. waters up to Alaska and so forth.
yeah,
So far this summer, I believe there's a dozen or so that are going through the testing or the simulated
right.
cruise program right now. So the numbers are there. I've been keeping track of all the start dates and so forth, the
Right.
global cruise industry. And between now and the end of December, we're looking at 160 to 180 cruise ships worldwide in an operation,
Mm-hmm.
approximately maybe 50% of the world fleet.
Yep.
Um, so yeah, it'll start cranking up. But
Yep.
again, it comes back to finding competent crew that you can
Sure.
get onto those vessels. You'll notice that there's constant changes and delays on certain cruise lines being canceled. And I think the number one problem there is because the manning of the crew
Sure.
and
Absolutely.
getting them online.
Yep. Great.
Okay.
Well, Gus, it's been great talking to you again. And you and I talk every couple times a
Oh,
month at
yes.
least. So thank you for being on with me, and thanks for your insight, because it's been very helpful for the last well 14 months plus, and it's going to
Yeah,
continue till we get beyond all this, and probably
that's right.
even after that. So
Yeah.
take care, be
Okay.
healthy,
Yeah.
and
Take care. Be safe there, John. Thanks a
yeah.
lot.
All right.
Okay. Bye.
Ciao. Bye bye.
Bye.